Joining me now is Dr. Margaret Harris. She is from WHO Communications and has spent a fair amount of time in Sierra Leone working on the Ebola response there. And Margaret, I want to kind of go over some of the issues that the member states are talking about there. First, WHO mounted a major response to Ebola. Tell me about the roles that WHO plays in a response like that on the ground.
In this response, there was an extraordinary range of roles. Normally, WHO plays a coordinating role. This is extremely important, and an advisory role. But in this one, WHO had to play a much wider range of roles than normal because this was, as everybody now knows, the biggest, an unprecedented and incredibly complex outbreak. So WHO, as I said, coordinated, provided assistance to all the partners who were coming in, helped make sure that the things that needed to be done had to be done, and worked very closely with the governments in order to ensure that all the roles and responsibilities were being met. That took a large volume of our staff. We had to send field coordinators right out into what we call the deep field, way out into the districts, because that's where the virus was often not only transmitting, but transmitting silently, so you really have to be out there and watching. We sent epidemiologists, people who are disease detectives, who really understand, again, not just what the disease is doing, but where it's doing it and why it's doing that. And they send that information back centrally to the people who then look at these things and decide what needs to be done next. Normally we don't do clinical care, but in this outbreak we had to assist with that as well. So we brought in partners who sent in foreign medical teams, and more than 40 foreign medical teams came to work in the 3 countries. And that made a huge difference. When people knew there was treatment, when they knew that people would provide them with beds, people would provide them with care, people would provide them with the fluids, and people were surviving. We've now got thousands and thousands of survivors. So then people started coming early for treatment, and certainly in Liberia that's one of the factors people think helped that country bring the cases down to 0. And as we now know, Liberia has been declared Ebola free. I could go on, but I think I need to give you a chance.
Yeah, the size of the response sounds quite large for an organization like WHO. Put some numbers to that for me. It's kind of hard to picture what that would look like in the field.
Well, right now it looks like almost 1,000 people in the field across the 3 countries. That's a huge number of people, much bigger than any number of people we've put on the ground. A lot of those people are WHO staff, but they're also people who've come through our networks from GOAN, the Global Outbreak and Alert Response Network, and from all the other kinds of responders who've come and responded to our call for help. It also means supplies, millions of sets of personal protective equipment. And when you see pictures of what that looks like, it's vast numbers of packages in sheds. It's vast amounts of logistics just to get them out there. We've also had people who train in all the hospitals to make sure people use that equipment effectively, keep on using it effectively, and consistently protect themselves.
Now, the member states are asking for some specific changes to the organization. Can you just tick through those for me, just a couple of the ideas so that we can see what kinds of discussions they're probably having the rest of this week in that drafting group?
So the member states have seen, as this evolved, that there was a need for a really fit-for-purpose emergency response organization, almost an organization within an organization, and that's what they're talking about. Within the WHO is the agency. They've all agreed that needs to protect public health. It's the guardian of public health. And as part of that, WHO needs to respond to health emergencies. So they're saying, right, we need to have people who've got the skills, who have got the flexibility to go out to the countries as and when required. We need to have the funding in place so that's possible. Not so that you have to then go out to the donors and say, please assist us, but you can send those people right away where they're needed. We need to have the set up, the understanding, a proper steering group that can manage this properly. People who are expert in emergencies, who can advise us and make sure that this runs effectively. Now, all those things have already been essentially agreed upon. They're now just working to fine-tune the details.
Because you're a communications expert as well as a doctor, I'm going to ask you one question that just came in from our Twitter viewers, because I know you can give me an answer in about the 20 seconds we have left, and that is, how will Ebola be prevented in the future?
There are many things. The first thing will be having really strong, resilient health systems that are able to detect the very first signs that this disease and any other disease that's a major threat to human health is out there. Second, that system needs to be able to respond, again, as quickly as possible and stop it.
And in a little bit later in this segment, we will be talking about health systems and what needs to be in place there and how they can be resilient to handle things like this. Margaret, thank you so much for joining us. I appreciate it.